Which one of the following mast cell products is not preformed and therefore has to be newly synthesized? A. Histamine. B. Prostaglandin D2. C. Heparin. D. Neutral protease. E. Eosinophil chemotactic factor, or ECF. And the answer is prostaglandin D2. This has to be newly synthesized. Prostaglandins and thromboxanes are newly synthesized by the mast cell during the cyclooxygenase pathway. The leukotrienes B4, C4, and D4, slowly reacting substance of anaphylaxis, SRSA, are also synthesized by the mast cell in this instant using the lipooxygenase pathway. Next one, type 1 hypersensitivity can be blocked using A. Histamine, B. An IgA myeloma, C. A myeloma protein of mixed antibody class, D. Sodium chromoglycate, E. Interleukin 5. And the answer is sodium chromoglycate can block type 1 hypersensitivity. Sodium chromoglycate is a mast cell stabilizer which makes the cell resistant to triggering. It is thus able to block type 1 hypersensitivity. Next, Mycoplasma pneumoniae infection can lead to A. Hashimoto's thyroiditis, B. Agranulocytosis, C. Cold hemagglutinin disease, D. Thrombocytopenic purpura, E. Neonatal alloimmune thrombocytopenia. And the answer is C. Mycoplasma pneumonia infection can lead to cold hemagglutinin disease. Patients with cold hemagglutinin disease have monoclonal antiblood group 1, leading to an autoimmune hemolytic anemia. Next, the term reactive lysis usually refers to a sequence of events involving A. Natural killer cells, B. Cytotoxic T lymphocytes, C. Antibody-dependent cellular cytotoxicity, D. Th1 cells, or E. Complement. And the answer is complement. Reactive lysis usually refers to a sequence of events involving complement. Following type 3 hypersensitivity reactions, activated C5b 6 and 7 becomes adventitiously attached to the surface of nearby cells and binds C8 and C9 to cause innocent bystander cell death. Next, chronic granuloma represents an attempt by the body to A. Wall off a site of chronic infection, B. Make a site of chronic infection accessible, C. Digest antibody-antigen complexes, D. Initiate an immune response, E. Change from a Th1 to a Th2 type of response. And the answer is A. Chronic granuloma represents an attempt by the body to wall off a site of chronic infection. A granuloma is a tissue nodule containing proliferating lymphocytes, fibroblasts, and giant cells, or epithelioid cells, both derived from activated macrophages, which forms due to inflammation in response to chronic infection or persistence of antigen in the tissues. Number 12, which type of hypersensitivity cannot be transferred with serum antibody? A. Type 1, B. Type 2, C. Type 3, D. Type 4, E. Type 5, and the answer is Type 4. Type 4 hypersensitivity cannot be transferred with serum antibody. Unlike the other types of hypersensitivities, 1, 2, 3, and 5, Type 4 delayed type reactivity cannot be transferred from a sensitized to a non-sensitized individual with serum antibody because T lymphocytes are required. Number 13, anaphylaxis can be triggered by cross-linking of IgE receptors on A. monocytes, B. mast cells, C. B cells, D. eosinophils, E. neutrophils, and the answer is mast cells. Anaphylaxis can be triggered by cross-linking of IgE receptors on mast cells. Cross-linking of IgE antibodies bound to the high-affinity IgE receptor on mast cells by a bivalent antigen will trigger mediator release. Trivalent antigens are more effective and tetravalent antigens even more so. Degranulation is also induced when the IgE is cross-linked with anti-IgE but univalent and anti-IgE is inactive. That the critical event is the cross-linking of the receptors themselves is clearly shown by the ability of antibodies reacting directly with a receptor to trigger the mast cell. Try to say that backwards. 15. The Arthus reaction is characterized by an intense infiltration by A. Mast cells, B. Neutrophils, C. Eosinophils, D. Macrophages, E. Langerhans cells. And the answer is B. Neutrophils. The Arthus reaction is characterized by an intense infiltration by neutrophils. The Arthus reaction is a type 3 immune complex mediated hypersensitivity in the skin characterized by neutrophil infiltration, edema and erythema maximal at 3 to 8H. So this happens often after an injection. Number 16, type 4 hypersensitivity is often referred to as A. Immediate, B. Delayed, C. Anaphylactic, D. Anergic, E. Allotypic. And the answer is B. Delayed. Type 4 hypersensitivity is often referred to as being delayed. Type 4 hypersensitivity involves T-cell recognition, and because of the longer time course of the reaction, this is sometimes referred to as delayed type hypersensitivity. Number 18. The major effector molecules involved in type 4 hypersensitivity reactions are A. Antibodies, B. Complement components, C. Cytokines, D. Prostaglandins, E. 5-hydroxytryptamine, or 5-HT. And the answer is cytokines. Cytokines are the major effector molecules involved in type 4 hypersensitivity reactions. Type 4 hypersensitivity is based upon the interaction of antigen with prime T cells, which then release cytokines which mediate the events which occur in this type of hypersensitivity. Next one, chapter 16, question 3. The human major histocompatibility complex A. Provokes the most intense allograft reactions. B. Is termed H2. C. Contains only class 1 and class 2 genes. D. Is not expressed as co-dominant antigens on the cell surface. E. Encodes the human leukocyte antigens HLA expressed only on leukocytes. And the answer is A. Provides the most intense allograft reactions. The MHC was recognized by its ability to produce the most intense graft rejection between members of the same species.